Welcome to this e-learning program. This is Ramakrishnan, Assistant Professor of Biochemistry from St.Joseph's College of Arts and Science, Cuddalore. In today's program, I am going to discuss the very essential one, which is known to everyone, is called obesity. Nowadays, doctors asking many of the patient, please try to reduce your body weight, because body weight increase may cause various health issues such as diabetes mellitus, heart problem, then fertility related problems. So all these things are all because of obesity. So obesity is defined as the excessive fat accumulation in the system which generates various health issues. So obesity of a person is estimated based on the body mass index. A person is having more than 30 as body mass index means considered as obese. So each and every person have around 30 to 35 billion of fat cells in our system, but they have almost a normal arrangement below the skin. These fatty cells are essential for thermoregulation and body texture, etc. But during obese, the size of these fat depositing cells gets increased. That is, normal person, they have 0.4 to 6 micrograms of weight, whereas during in obese case around 1.2 micrograms, around 3 times getting increased. So it doesn't mean that fat is a dangerous one for our system. Apart from that, this when it is under control means they play vital role. For example, important for maintaining the cell membrane arrangement, intracellular organelles such as mitochondria, Golgi complex, all these things are all made by cell membranes, that is by lipids. Then fats are essential one for as the storage form of energy, so that energy is released during starvation period, and it is very good for a very good insulator for regulating the body temperature and action of nerve potential. It gives proper smooth contour and a beautiful look for body, and lipids act as chemical messengers, and cholesterol is essential one for vitamin D3 synthesis and bone development, that is comes under lipid. Then regulating the inflammation condition by producing the secondary hormones called prostaglandins. Like this, lipids are very essential one for our biological functions, but the level, that is intake and burning, is the factor for a person is good or under obese. So publication states that according to the first law of thermodynamics, energy can neither be created nor destroyed, but one form of energy is converted into another form. Same way, a person consumes high energy intake and expenditure should be equal, then the person is normal. Suppose energy intake is high and the expenditure of energy is very less, means leads to obesity. So that causes various health issues such as heart diseases, including myocardial infarction, coronary artery disease, cardiovascular diseases, and so on, and induces for a type 2 diabetes. Then hyperlipidemia, that is increased level of cholesterol, increased level of free fatty acid, increased level of triglycerides, and so on. So while taking the lipid profile from the patient, we will come to a conclusion regarding this hyperlipidemia. And similarly, hypertension, that is increased blood pressure. Then osteoarthritis, joint problems. Then obstructive sleep apnea, that is a temporary loss in the breathing during sleeping. Then it will be regained. It's not a lengthy one, a short period. So it is very dangerous one. During sleeping time, when this apnea comes, means the person has to be retrieved as quickly. Then among them, type 2 diabetes is mainly induced by obesity. Then myocardial infarction, that is a heart attack. Obesity favors heart attack. Then fatty liver, that is a elevated level of fat gets accumulated in the liver, and it is a negative one for other metabolic activities. That is a function of liver getting decreased. Then osteoarthritis, problems in the joints, knees and backbone pain, knee pain, like this. So all these problems arises because of obesity. What are the common sign and symptoms or causes for these things? When we consider the causes, it is mainly because of consumption of high calorie food and taking more sugar soft drinks. Then apart from that, our sedentary habits, that is watching television without having high physical activity, taking more relaxed situation, and that is watching television, using that handheld devices such as mobile phones, and then additional things, spending time in the electronic devices. Then hormonal imbalance, particularly during menopausal period. Then thyroid hormones and the steroids over production, all these things favors for obesity. Then illness like hypothyroidism, polycystic ovarian syndrome, and use of certain drugs like steroids, antidepressive agents, anti-epileptic factors, anti-hypertensive drugs. These are also increases body weight. And low physical activity with the stress. Then heredity also favors for obesity. What are the common signs and symptoms for this obesity? Just by the appearance of your patient, doctors will easily judge the obesity. But anyhow, large body frame, difficulty in doing daily activities, lethargy, breathlessness, disproportionate facial features, breast region adiposity, then big belly with the male external genitalia may appear somewhat smaller than the normal one. Then flabby fat in the upper arms and thighs. These are the common symptoms for obesity. The detection or diagnosis of obesity. This is by calculating the BMI, that is body mass index. It is easily measured by finding the two factors, weight of the person and the height square in meters. Height and weight is need for calculating the BMI. So nowadays online formulas are available. Just you include your just enter your weight and height in square, that is meter square, weight in kilograms and height in meters. We will get the value in the next moment, or even you can use your calculators by using these two factors. The reference level should be 18.5 to 24.9 is normal, and 25 to 29.9 is overweight, and 30 to 39.5 is obese, and more than that is extreme obese case. That means those people, they need help from others for their own daily activities. So second method to evaluate the diagnosis obesity is waist circumference. Waist size is greater than 35 inches in female and greater than 40 inches in male is another diagnosis for obesity. When we look the treatment or control measure for obesity, it is purely with the hands of the person. So treatment will be carried by 3 stages. First one is dietary management. That means reducing the fatty food intake, then consumption of low calorie diet, and the calorie should be less than 1800 calories per day. That means whatever the things we need for our daily activities. Then reducing high sugar diet, then increasing the vegetables and the fiber food, reducing the fast food and fried food, reducing the consumption of alcohol, smoking, etc. Then second part is health management, that is increasing the physical activity. This is the most important area focused by doctors. Long walk, running, swimming, jumping, jogging, and so on. That is increasing the physical activity may burn more calories, thereby the person will fit. Then third part is drug control. The drug control is purely by doctors, not by the person. So as per the lipid profile analysis and BMI calculations, doctors will suggest the third method, drug control. It is based on the focusing of two parts. One is decreasing the appetite, that is decreasing the hunger. In brain we have two parts, that is inducing the hunger and inducing satiety. Similarly, here the hunger part will be reduced by in taking therapy or drugs. Then similarly, increasing satiety, that will some tablets available that is recommended by doctors, that will induce satiety. Thereby the person feels enough, that is food enough. When we attain that satiety, we may not go for further need of food. Though that is the best one from the doctor's recommendation, not by own tablet method. Then additional one, drugs which controls the lipid metabolic change, that is statin drugs like this. And once again, this is also recommended by doctors, that is by studying the lipid profile. But anyhow, by the cooperation of patient, we can control the obesity and we will win the world. But in this case, we should remember a famous quotation from Benjamin Franklin: few die of hunger and many die of eating. That is more suitable term for obesity. Thank you.